One problem in our world is that some people, including those with immune deficiencies, are not familiar with how influenza drugs work and therefore tend to stay away from them. In this presentation, we will explore the drug oseltamivir phosphate, also known by the common name of Tamiflu. We will explore it from a chemistry perspective, looking at history, chemical structure and function, side effects, and more, all in order to educate those who lack information on drugs.
Yeah, thanks Sim for introducing Tamiflu to us. I'm Misha, and now I'm going to talk about the historical of influenza. Because of the lack of accurate and consistent records, it's challenging to accurately determine influenza from historical reports. But epidemiologists generally believe that the 1518 influenza outbreak is the earliest known epidemic. And after influenza began to spread around the world in an annual outbreak, resulting in a large number of deaths every year. People significantly suffered from influenza, and there was no effective way to deal with it until the first influenza vaccine was invented and used for clinical trials in the middle 1930s. From 20th century, the pandemic was recorded 5 times, starting with the dead Spanish flu. These 5 pandemics was shown in this chart as you can see. You may also notice that there is an increased number who infected with influenza, but a decrease in deaths in the world well. That's because this is also the time for variant isolation and vaccine development. People become familiar with the flu and make effective vaccine against it. However, the influenza still occurs every year, as you can see at the bottom of this chart, and many people die from it. Because the efficacy of current available vaccine is still insufficient to reduce the current immune health burden caused by the virus. Actually, outbreaks of new influenza strains still occur. Tamiflu is one of them and can against the flu effectively. So let's move to the next slide. And Abdullah are going to introduce the chemical structure of Tamiflu to us.
Influenza. Now let's switch on to talk about the chemical structure of oseltamivir phosphate, which is known as Tamiflu. In pharmacological terminology, it is known that drugs usually can have many terms. For example, in our case, Tamiflu is known as the brand name, while oseltamivir phosphate is the generic name, which is like a class or group, while also we have the IUPAC, which is mostly related to chemistry. For example, here we have this long name for this compound. We can generate from that many things that can give us a hint of how this compound looks like, how it's chemically look like, what are the functional groups do we have here, where those functional groups are located, and if we have like triple bond or double bond, where can we find these bonds, and therefore let's talk a little bit about the bonds properties in oseltamivir phosphate compound that can be illustrated here. So in this compound we have 22 non-hydrogen bonds, we have 3 multiple bonds, 8 rotatable bonds, we have also like 3 double bonds. So like I know some of you can ask why understanding these bonds is important, how those bonds can impact how this drug is going to work. So basically understanding how these bonds work and how how functional groups are connected to each other is essential for the chemist and for the pharmacological scientist because sometimes, for example, we have a real life example here. Liters 2012 explored a new synthesis of azotamidor phosphate. He substitute several function groups that are in this compound by the shikimic acid. Uh, like he want to know like how to cut the cost of the Tamiflu. So when he investigate this type of this new functional group, it's important that he know how these functional groups are going to bond to each other. Does this bond can have could impact how this drug is going to work inside the body because like we know like we have several types of bonds such as covalent and ionic. Some of them are strong enough and some of them are very weak. So uh, those are very important for the scientist to know or to be sure that this drug is going to work effectively. Now, Siobhan is going to talk about the function groups and
Functional groups provide drug molecules with different properties and behaviors. This allows them to provide certain effects, such as a single functional group serving two purposes or properties, or the properties of a functional group being changed by the functional groups around them. Functional groups have three chemical properties: solubility, steric, and electronic effects. When adding a functional group to a molecule, all three of these chemical properties have to be taken into account because only one can never be altered. Some of the benefits of these chemical properties include the ability to interact with biological targets and the length of the time the drug is active being altered. Oseltamivir works by blocking an enzyme called neuraminidase. This allows the virus to spread more easily by splitting sialic acid residues on new virions. Oseltamivir blocks the enzyme's ability to split sialic acid residues on the infected cells. This then stops the release of virions from cells that have been previously infected. Blocking the enzyme prevents the spread, which in turn shortens the duration of symptoms, and the length of symptoms are reduced if the treatment started within 48 hours of infection.
Hello, everyone. I'm going to be talking about the benefits and negative effects of Tamiflu. First, Tamiflu reduces the symptoms of the flu. This includes fevers, stuffy nose, sore throat, aches, and tiredness. Tamiflu also reduces the time needed to recover from the flu. It also decreases the likelihood of serious complications that can result from the flu, such as pneumonia and hospitalization. Tamiflu has been proven to reduce the likelihood of someone catching pneumonia by 44% and hospitalization by 63%. It also reduces the chances of someone catching the virus, which is why Tamiflu is prescribed so often. Tamiflu also can affect the person's physical and mental health. This includes vomiting, diarrhea, stomach pains, dizziness, and headaches. And on rare occasions, Tamiflu is known to cause hallucinations and unusual behavior. In 2007, teens in Japan were exhibiting unusual behavior and were committing suicide. Health experts were able to trace this phenomenon to Tamiflu. This phenomenon caused health experts and the FDA to become more strict when releasing medications to the public. And now I'm going to be passing it over to Blake, who's going to be talking about the FDA process.
So, moving on to the FDA process, the FDA has a multi step process that a sponsor of a drug must go through. It consists of about 12 steps, and all of this can be found on the FDA's website. I'm not going to go into too much detail about it, but to just briefly outline what happens during this process, it involves discovery, which then moves to preclinical trials on animals, and then after that moves to clinical trials on humans, which there's 3 phases during that, each phase involving a larger group of people. The FDA will then review all of the data, whether that be the chemistry of the compound itself, the research that went into the chemistry, the testing done on both the animals and the humans, make sure that everything is in order and that what is supposed to be done to the desired target is being done. After that step is done, the FDA will then check the manufacturing facilities and make sure that there is no possibility of contamination during the manufacturing process. And if they make it through that step, the FDA will then allow them to distribute to the general public. So the FDA's process is really important because it makes sure that drugs and the chemistry behind the drugs is all vetted properly and weeds out the drugs that don't meet expectations. As we are people using these drugs, and in the terms of Tamiflu, we use this drug to treat a very well-known virus of the flu, which is not fun, as anyone that has had it knows. The FDA is making sure that the chemistry behind it was proper and the research was done, and that everything that the drug is supposed to do was in fact happening, and that there was no bad side effects that were caused by the drug. And they make sure that it's safe and effective for use so that we will be safe when taking it. So then, transitioning briefly to the coronavirus, we thought we would add in a brief thing about the coronavirus, since every drug and vaccine being tested right now to treat the coronavirus have to go through this process for us to use them. There's a website actually called Clinical Trials Arena that is linked in our reference page, where it shows all of the drugs and vaccines that are being tested by the FDA right now. Some of them are foreign drugs. I know that there's one in China that is approved for people to use in China, but the FDA is now testing to see if we are going to be able to use it, and it's used to treat symptoms of the coronavirus. But it shows all of the different drugs. It's a really cool website. I do recommend checking it out. But it just shows, I mean, chemists all over the world are testing different compounds, both new and old. Even Tamiflu, I believe it is not useful for targeting the coronavirus, but it was tested by the sponsors of the people that distribute Tamiflu to see how it affects the coronavirus. So this is all kind of just tying into how important the FDA's process is to make sure that we're safe when using these drugs and putting these chemicals in our bodies. So then transitioning to the conclusion, that'll be Sam doing that.
Influenza has remained a consistent issue in human life ever since it broke out in the late 16th century. It wasn't until the 1930s that development of drugs began. While many drugs have been created to fight off the flu, Tamiflu has become increasingly popular in the last 20 years. Oseltamivir phosphate has a fairly complex chemical structure with 5 different functional groups and varied molecular geometry. We have shown that there is a low risk of side effects with this drug, and we hope that our presentation can help to spread information about influenza drugs to those who need it most.